Hey guys, this is Leah Buckles from Prestige Worldwide Medical Consulting. I am a U.S. Army veteran, physician assistant. I wanted to come on today and discuss battlefield acupuncture. This is a type of acupuncture that was developed by an Air Force veteran, Dr. Niemtzow. It's a mouthful, but Dr. Niemtzow, and he created this type of acupuncture to make it much more accessible to service members, and also make a program that was just going to be able to be rapidly deployed out to healthcare professionals that were in the Army or Air Force or wherever, to be able to provide some pain relief that was non-traditional pharmacologic pain relief for conditions. So acupuncture is a form of Eastern medicine that has been around for hundreds and hundreds of years, right? So in regular acupuncture, needles can be placed throughout the body from head to toe that correspond with just different areas of pain or dysfunction. Battlefield acupuncture was developed, and it's a form of auricular or ear acupuncture that can be utilized to help in the management and treatment of pain, right? What's interesting that many of you may not know is this is something that in the military we provide quite frequently. In fact, I was credentialed to do it and authorized to do it when I was on active duty, and it helped many service members. Now, it didn't help everybody, but a lot of service members had positive effects from the treatment of it for, various orthopedic conditions, migraine headaches, lots of stuff, right? It could, not necessarily used for stress and anxiety, but many veterans would say that it helped reduce their stress and anxiety, help them sleep better, etc. So in this form of acupuncture, by the way, it's also widely available in the VA. So you can certainly, I don't know if your primary care clinic will do it at the VA, but the pain management clinic, certainly there's probably many credentialed providers that do it. And so it's widely accepted at the VA, and they actually push it and like to do it because it's a non-pharmacologic therapy that can be helpful to a lot of veterans, right? So, maybe ask your healthcare provider if it's something that would perhaps help you, okay? So this form of acupuncture is super interesting. We use these little needles called Asp needles. Here's a box. I still have an old box of mine. Asp needles. Don't ask me what the A stands for because I can't pronounce it, but it's semi-permanent needles, right? So these needles are super tiny. They come in a package like this, right? They're really small, and they basically... This looks big, but this is just the plunger. The needle's actually teeny tiny, and it's at the end, okay? And so these will go in your ear, right, in a certain protocol. I have a picture here that I want to show you guys, okay? So if you see here, see all those different points? There's 5 points, and those are the points that they go in, okay? They're called point 0, cingulate gyrus, the thalamus, Shenmen, and omega 2. Okay, those are, I know that's kind of not super important what they're called, but those are the points, okay? And as you can see, I have them in my ear right now, okay? So you can kind of see, there's one, there's one, there's one, there's one, and then I should have one a little bit higher up. It might have fallen out. It's typically right up here. Okay, so you have 5 little points, and typically we do both ears. Sometimes in a person that hasn't had it before, we may just do one ear at first, and then the needles will just stay in for about 5 to 7 days. Sometimes they'll start falling out sooner. They're tough little guys. They're teeny tiny, but they pack a little punch when they go in. As you can see, my ear's a little bit red from when I just recently got mine. But they can be, very helpful. One thing is they can some people will say there's a little discomfort when you sleep on that side, or if you put your cell phone up to that side, but you can have some significant, it's helped me considerably with, pain from my, back and my knees and things like that. Of course, this is not my medical endorsement of it. I'm just trying to put out good information for you guys so that you can maybe ask your healthcare provider if it's a good option for you. Because it is something that's out there and available in the VA world, that's free for you if you're a veteran that gets VA healthcare, and it's pretty awesome. So I hope you guys learned something. Let me see if there's anything else I want to hit on in my little packet of information that might be helpful to you guys. Okay, so you know, side effects. Of course, there's some side effects. You know, you can have a couple drops of blood in the area, perhaps because you are poking a needle in there. You can have some pain because you're poking a needle in there, right? You can have, like I said, pain when you sleep on that side. Some people don't. There's always a risk of infection, of course, but these are things your healthcare provider will go over with you and to determine if it's a good option for you. So I hope this was helpful. Battlefield acupuncture is awesome. As a patient, I'm giving you my recommendation. I think it's pretty cool. But just make sure you follow up with your healthcare provider and see if it's something that they would recommend for you, and let me know how it goes. Drop some comments if it's something you've done before or you think is pretty cool. Let me know what your experience was with it, and I hope you guys learned something today, and I will talk to y'all soon.